There are now 18 confirmed cases of the virus in the Houston area, at least one of them believed to be the result of community spread, meaning it was spread from one person to another. That's why everyone is being urged to practice good hygiene, avoid large gatherings, and stay home if you are sick. Doctors say it is important to prevent a spike in cases because we only have a limited number of coronavirus test kits available. Matt Doherty went to find out why the U.S. seems so far behind here. Matt?
Experts and officials agree that a lack of testing has likely led to an underreporting of cases. They say not just across the country, but also here locally. Here in Galveston County, they have yet to see their first medically confirmed case, but health authorities here say it's probably already here. Testing for the coronavirus in the U.S. has been a problem from the start. At first, the CDC rejected the tests provided by the World Health Organization in favor of its own. But those tests turned out to be faulty and couldn't be used. By the time the corrected tests were produced, we were already in trouble. The disease had started to spread. When the new ones came under the CDC's rules, only patients who fit within a narrow scope of criteria could get one. One of the requirements, the individual must have recently traveled internationally. All those confirmed cases we saw in Harris and Fort Bend counties from that cruise in Egypt were obtained when those rules were still in place. Local officials reinforced the message that cases in Harris and Fort Bend counties were all travel related, and there was no evidence of community spread.
For the rest of those in Houston, in Harris County, Fort Bend, in the region, it's of low risk, and there's no indication of any community spread.
But this week, rules for testing changed as more tests became available. Today, we learned that not every county is managing the tests the same. Dr. Philip Kaiser is an infectious disease doctor at UTMB. He's also the health authority for Galveston County.
Ideally, the way this should work is the way Montgomery County is doing it, is that, you have a problem, you go see your doctor, he orders the test comes back to him. If it's positive, then they contact the health department.
The Montgomery County Health District says since Monday, commercial labs have been processing patient samples. Up there, testing is performed at private offices, clinics, urgent cares, and hospitals. In Galveston County, UTMB can test up to 20 people per day. The rest of its samples are sent to the Houston Health Department, who also services all of the city as well as Harris and Fort Bend counties. Now, we asked all of the local health districts in our area earlier today how many total tests each one of them has performed since this whole thing started. Montgomery County says it has performed 18 since it began. The rest of the counties in our area said they would not give us those numbers. Lynn, back to you.
All right, Matt, thanks for the update.